Hi, it's Atul Kamath at Kamath Orthopedics. I want to talk to you a little bit about outpatient surgery for joint replacement. Orthopedic surgery and joint replacement has come a long way over the last couple decades. Patients for standard hip and knee replacements used to stay in the hospital for 3 to 5 days sometimes after a routine joint replacement. Of course, back then, pain control methods were a little bit different. Incisions were a little bit larger, and rehabilitation protocols were somewhat different. So the combination of multiple advances in medicine as well as in orthopedics have allowed us to really get patients back on the road to recovery very quickly and very safely. For the right patient, outpatient joint replacement actually has a number of advantages. You can come in for surgery in the morning, have your surgery, and then be back in your home by the early afternoon for most patients. We get you up and moving immediately after surgery, and this has a number of benefits, not just physically to get you moving, but also psychologically. We know that patients, if they can get up and rolling and moving quicker, actually have better outcomes in terms of their outlook on their recovery trajectory. And the early healing is the most important, and then also the early motion and early activity really helps kickstart patients into that faster recovery mode. And this really plays into a number of things that we've innovated in. Minimally invasive surgery techniques, better education preoperatively as well as postoperatively, other digital apps and mobile apps that help educate patients in real time, and a lot of good pain control measures that we've instituted both perioperatively, intraoperatively, as well as in the postoperative period. So we can keep you comfortable, get you moving, and then safely move you faster along that recovery trajectory. We also know that for outpatient patients or patients who can avoid hospital stays, actually their risk of infection is lower, and the risk of other complications is actually lower as well. And then other risks of actually having to come back into the hospital, what we would call a readmission for a problem, is actually reduced for patients that have surgery as an outpatient. So outpatient surgery is really only interfacing with the healthcare system for the critical portion of a surgical procedure because conditions like hip and knee arthritis are generally wellness conditions. Patients who undergo these elective procedures are otherwise healthy enough to undergo a joint replacement. So if we can perform the joint replacement safely as an outpatient, you come into the hospital for the surgery and you leave that surgical facility on the same day, you can be back in your own bed, eating your own food, and again, recovering in the safety of your own home. We can send folks to your home like a therapist or a nurse, or use mobile or digital modes of recovery to help coach you and educate you in your recovery. Even folks who live alone or take care of themselves, if they have friends or family that can check in with them, if they have the ability to interface either through phone communication for touch points once or twice a day, we found that they can actually recover as well at home as an outpatient basis. And also for outpatient surgery, we don't need to do joint replacement in very large healthcare systems or large hospitals. We can now perform joint replacement in smaller, hyper-focused or very focused facilities like ambulatory surgical centers with teams that routinely perform these procedures hundreds or thousands of times per year. So you have dedicated teams focused on hip and knee surgery, specifically joint replacement, performing procedures in a routine fashion for you to safely and expeditiously get you back on the road to recovery. So we've paired a lot of good technology with advances in pain management and surgical technique, and really we've built education and teams around safely taking you through this journey. So I welcome you to ask your orthopedic surgeon about the ability to do outpatient joint replacement. And again, here at Kamath Orthopedics, we routinely perform outpatient joint replacement and enjoy taking care of you for your procedure, and then just getting you back to your home and your home environment for a good night's sleep on that night of surgery. So we look forward to taking care of your hips and knees. And again, outpatient is a growing trend in orthopedics, and certainly patients are really enjoying the benefits of outpatient surgery. So we'll see you soon at Kamath Orthopedics.